Ma question porte sur...
I would like to ask a question about wearing masks in schools. In Switzerland, wearing masks in schools is not mandatory for those under 16. In France, however, it is mandatory for those under 11. That's a recent change in France, and yet the two countries seem quite similar. So is there some scientific evidence about the role of children in transmission? Is there any fresh information about that might explain this? So that's my question. Thank you.
So thank you for the question. I will begin. Yes, so there is a lot of research that is happening right now on children of different age groups. And we're learning, we are constantly learning. So one of the things we know about infection in children is that children can be infected, children of all ages can be infected with the SARS-CoV-2 virus. Luckily, the majority of children that are infected with this virus do tend to have mild disease or asymptomatic infection. But there are some that can develop severe disease, and there are some children, unfortunately, that have died. What we understand about transmission in children is limited. There are some studies that are looking at transmission by age groups, looking at under 5s, for example, looking at up to 10 years old, looking at teenagers, and looking at young adults. These studies are preliminary, and there are few that are available, but there are more that are being conducted. And there appears to be a difference in transmission by age group, with the younger children able to transmit less than teenagers, for example. But this data is really limited, and there are some studies that are ongoing. WHO and UNICEF will be issuing guidance on the use of masks in children, and we break this down by age. The guidance will be available in the coming days, if not today, where we give advice to decision makers, and we give advice to public health officials and child health professionals and educators about making the decision about when and where masks can be used. And we break those recommendations down by age, looking at under 5, looking at 6 to 11, and then looking at over 12. But again, there's limited information that we have on children. There are more studies that are being done. We're working with a large number of partners, including UNICEF. We have a technical advisory group that we have established to specifically support us on understanding and advice for educational institutions, knowing that different institutions look differently across the globe.
Thank you very much, Dr. Van Kerkhove.
Margaret, can I just add? Margaret, can
Please
I just add?
Go ahead.